My name is Jen Cherewaty. I'm the registered acupuncturist and Chinese medicine practitioner here at Crossroads Naturopathic, and I've been at Crossroads 11 years, and I've been practicing this medicine for 20 years. I got into Chinese medicine and acupuncture because I'd had a bad car accident in the early 90s and fractured some vertebrae in my low back. And I had never been to any kind of alternative therapies before, and I started having physio, acupuncture, chiropractic, and they all really helped me recover from that back pain. And then I started studying herbal medicine on correspondence because we didn't have any online at the time. And then I was really intrigued by that and thought, if I'm going to do this for work, I need to do a proper training. So I went to the naturopathic school in Toronto for a year, and then this is where I found out quite a bit more about acupuncture and Chinese medicine, and then I transferred into a specific Chinese medicine program in Nelson, BC, and completed that 4 years study. I've been practicing here for about 20 years now. So I was having pretty severe 10 out of 10 pain every day from my accident onward for many, many months. The doctors that I saw wanted to do a pretty severe surgery to fuse my vertebrae together in the back, and I thought there must be another way, and so I started investigating other therapies and doing chiropractic, physio, massage, acupuncture. A combination of all the treatments really helped to get my back in the proper alignment, and also helped to relax the muscles and tendons, and also helped heal a bunch of other health issues I had. It was really eye-opening to go through that therapy and realize there's other things besides surgery that can help one recover from a car accident. Well, Chinese medicine is like the comprehensive title that overlays the training that we get and the modalities we use. So underneath the umbrella of Chinese medicine, our main therapies are acupuncture and Chinese herbal medicine, but we also incorporate diet, therapy, nutrition, massage called Cui Nan Chinese medicine. We do gua sha, which is like scraping with jade tools. We do cupping with glass cups, and there's also mindfulness training and counseling as well. So it's really, Chinese medicine is really an umbrella term for all the modalities that we use in our medicine. A great percentage of my clients find me as referrals from friends or other practitioners who know me. When they come into the clinic, they will have a nice conversation about their health history. We'll focus mostly on their main concerns at the time, but we'll do a comprehensive conversation about what brought them to this place health-wise. And then I'll always do an acupuncture treatment for them in that first session, and then I set up a treatment plan for them involving the frequency I recommend for acupuncture, some Chinese herbs you might benefit from, different dietary suggestions that might help improve your health, and then also just different lifestyle practices that may be beneficial. Some people aren't moving at all, some people are moving too much, some people are not sleeping properly. So we take the whole health history and then we work to try to bring you back to a better place of health for whatever condition you're coming in for. I'm very grateful for the common medical system that we have. As a Chinese medicine practitioner and acupuncturist, I don't have prescribing rights or authority to do blood work or order x-rays or other scans like that. So the medical system is essential for those things. How I work together with a lot of medical doctors is I will often recommend certain blood work for clients to get done that they can then request from their doctor, especially with my fertility clients or women's health clients. So I'll recommend certain things get tested, they'll get them from them, and then we'll get the results back, and then we'll address it from a functional medicine perspective. Also, some clients who've had chronic pain in a certain area, like shoulder pain, for example, there's certain scans that they can get done that can help us see what's really at the root cause of what's going on. Do they have calcification in the joint? Are the tendons wearing down? Is the cushioning between the bones degenerating? I have a lot of clients who have low back pain, and then having a scan done so we can see, like, is there any degenerative conditions going on, or is it really just a muscular issue? So it's very helpful to work together with the medical profession to get proper diagnosis. One of the great things now actually is the naturopaths have recently been giving authority to order scans. So now if clients see one of the naturopaths here, I can easily refer them to the in-clinic naturopaths, and they can get that ordered through them. That is a huge shift forward for naturopathic medicine. Often with the work I do, all women will have reduced symptomology if perimenopausal, menopausal symptoms, but some women need a bit more support, and that's where the hormone therapy is very beneficial, and I don't consider it a failure at all when women get to that point, and it's whatever the client, the woman, needs in order to just feel like she can sleep well and not have hot flashes and night sweats, have their brain being able to function so that they can do the work they need to do, support their children, their partners, their parents, neighbors in a way, and have some time left to enjoy their life. I have a lot of clients who are apprehensive about acupuncture. They're afraid of needles, but over my 20 years of practicing, I've just developed a technique where I'm very gentle. When the points go in, sometimes you'll feel a little bit of sharpness on the surface, and sometimes you won't, and then you'll just feel numbness or tingling or aching when the points go in. So I think the fear of needles is one of the biggest things that people are worried about. So I invite clients to come in and we'll just do a light treatment to start with and make sure they're feeling comfortable with the sensations they're having. And for most clients, they find that it's not at all as painful as they think it's going to be. The other piece we have available to clients is we do these virtual meet and greets where we can just have a brief conversation about what your health concerns are, and then I can share how I would work with that to support your health, and you can meet me, and then that often creates a connection that people mostly do feel comfortable with, and then they're more apt to come into the clinic for support. As I have a specialty in fertility and women's health, if you have any concerns about how your hormones are doing and you're having symptoms, you're trying to conceive and you're having difficulty, you're conceiving but not being able to hold a pregnancy, you're having severe period pain every month, PMS, mood symptoms, or you're entering into your menopause time and you're having night flashes, hot sweats. All these things can be treated with acupuncture, Chinese medicine, and lifestyle support.